That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hey everybody, welcome back. Hello.
Hi. Welcome back to us too.
That's right.
Because we did not record.
Yeah.
Last week was Thanksgiving.
That's right. Although when you're watching this or listening on a podcast, it's sometime in December, I'm sure.
Wow.
Maybe it's close to Christmas. So Merry Christmas. But we're recording this
Today.
in November, and it's right after Thanksgiving. So,
Last day of November.
you know, speaking of Thanksgiving, we eat a lot on Thanksgiving. I had the biggest plate of dessert I've had in over a year after
impressive.
Thanksgiving. Well, I mean, it was a half slice of cheesecake
I know.
and a piece of tiramisu
Yes, a very small slice
and a cup of
tiramisu.
coffee. But it was the biggest dessert I'd had. So it's neat because we're going to talk about some weight loss again, because these weight loss drugs are all over the news. But let's introduce ourselves.
Oh, yeah.
So this is the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and this is Brandi Rashidian, my bride, my other half, my partner in life and business for the past 18 and a half years.
He does that for me because I forget how long it's been.
That's right. 18 and a
Thank you.
half. And it's been a great ride. And we've been doing the podcast now over 6 months, I think.
Yeah. I
So
think
this is fantastic. And we
We should
lasted.
keep going.
I'm enjoying it.
Me too.
And so on the Real Health Podcast is where we teach you how to feel better, get stronger, live longer, and feel younger. And those are all tremendously important things. Sorry about the phone ringing. So what we do here is we look at articles, we look at the latest news,
Yep.
and we summarize these articles for you and tell you our perspective on it, which is a wellness, holistic, natural perspective. We are not anti-drug people. We just think drugs should be last resort and surgery should be last resort, equally. I don't think one is worse than the other or better than the other. Both change things on the inside of the human body
That can't be predicted.
in an unnatural way.
Yeah.
And so natural is better, always. That's what we believe. And so let's get right into it. Our first article, it says, this is from NBC News. FDA approves weight loss drug from Eli Lilly that helped people lose up to 52 pounds. Now, right off the bat, okay, this is what I'm thinking. Where did the pounds go? Like, did they lose 50 pounds of fat? Or did they lose, a combination of fat, bone, muscle, and water weight? Like, they're not looking at any of those things. They're just putting them on scale and going,
Correct.
oh, you're 52 pounds lighter.
And that's really, I think the biggest issue is that when someone is overweight or obese, the only thing that is important to them is that number on a scale. That's such a small fraction of the picture of what's going on. I mean, we work with our health coaches, right? Our fitness coaches, and they all have their pro cards. So they know how to build the body. They know,
Like these are coaches who are coaching us. We are their
correct.
clients.
And they all have their professional bodybuilding cards, so they've competed and have done very well.
Hello, Alan, if you're watching.
Yep, and Yvette. But the one thing that I've learned through this, and I've been one of those people, I have been overweight a lot in life. I've been tiny, and I've done the yo-yo diets, and I've gone carb-free, I've gone fat-free. I've done all of those different fad diets, if you will, but nothing has provided long-lasting results, right? And it's disappointing and disheartening when you end up yo-yoing like that. So right off the bat, I struggle with these because I know while we're helping someone to be able to lose weight they haven't been able to lose, we're really not changing any lifestyle with this. And so my fear is that,
In fact, we're teaching the wrong lifestyle.
correct, because we're saying, hey, you can go ahead and eat whatever you want, and then there's this pill or potion that you can take, right? Or worst case scenario, we'll do a bariatric surgery. and we'll get rid of that. Well, I've actually had family members. My father had a bariatric surgery when I was younger. He went from like 350 pounds down to 160 very quickly, which is a massive drop. But I can tell you, no one told him that he shouldn't be eating Kit Kats. No one told him, and I don't know, maybe they did, but the opening to his stomach was like a pinhole. So he couldn't eat, but he still tried eating the same stuff he always ate. So what ended up happening? He never changed lifestyle, and he ended up gaining all of that weight. So you do put your body through all of that unnecessary stress of a surgery or pharmaceuticals, but we're not doing anything on the other side. So we end up in this vicious cycle. So I mean, I'm happy that somebody can get the weight loss, but you're not losing fat alone.
So the analysts predict the weekly injectable medication could become the best-selling drug of all time. I don't doubt it.
I don't doubt it either.
Yeah, I mean, if we're saying more than half,
Americans love to eat.
I don't know what the number. I think the numbers are in here, but the FDA on Wednesday approved Zepbound, 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 a new weight loss drug from drug maker Eli Lilly that was shown in clinical trials to help people lose up to 52 pounds in 16 months. So at least it's not rapid
Right.
loss.
It's not like 3 or 4 months, which is
16
good.
months, that's pretty good. Zepbound is the latest entrant into the field of powerful new drugs that already includes Novo Nordisk's Ozempic and Wegovy, and we reported on both of those.
Yes.
And then there's also Eli Lilly's Mounjaro. But Wegovy and Ozempic were originally for diabetics, for type 2 diabetics, and they, because of the weight loss properties, they renamed Ozempic Wegovy and said this one's for weight loss. So
Right.
It's the same drug.
Well, and Mounjaro also is a diabetic. It's a blood sugar drug that they're using off-label use for
So the
weight
FDA
loss.
approved the drug for adults with obesity who are overweight with at least one weight-related condition. They don't define what that weight-related condition is.
Yeah, I'm confused
assuming
about that.
arthritis or diabetes. I mean, or heart disease. And those
Yeah.
are three main things that weight can cause. It will carry a list price of $1,060 per month's supply.
Yep.
And Medicare by law does not cover them. So, because Medicare has stated, in fact, and emphatically, that we will not do anything that promotes wellness or longevity.
Yep.
This is written in all their documentation. We will not approve anything that promotes longer life.
Yeah. Well, I mean, then they have to keep paying.
Right. Not that I'm saying this will promote long life. I think lifestyle changes is what promotes long life. But anyways,
100%.
in the United States, 4 in 10 adults have obesity, according to the CDC. Zepbound is part of a class of drugs called...
That's a lot, by the way. 4 out of 10 people.
Yeah. And, they keep changing the definition of obesity as well, and so it's interesting. I think the number's even higher.
Oh, I'm sure.
I think something that maybe in the 1970s they would have considered obese today is not obese anymore, because just the overall average weight of all humans.
Well, we like to do that. We like to change the measuring stick, right, on
Yeah.
things so that we can make it look better or worse, so that we can promote whatever we want to promote.
Right. Oh,
It's
yeah.
sad, but that is how our
I
world
did
works.
2 years of research. I know how to manipulate data. Zepbound is part of a class of drugs called GLP-1 agonists, which mimic a hormone that helps reduce food intake and appetite. However, Zepbound also imitates a second hormone called GIP, which, along with reducing appetite, may also improve how the body breaks down sugar and fat. Zepbound shares the same active ingredient, tirzepatide, as Lilly's popular diabetes medication, Mounjaro. In a phase 3 clinical trial, Zepbound led to an average weight loss of 22.5% body weight, or about 52 pounds, surpassing all currently available weight loss medication on the market. The weight loss seen from the medication is approaching the weight loss seen with bariatric surgery. So this is the only drug that comes close to bariatric surgery.
Yeah,
But
and
like
I found it interesting that they said 52 pounds over 16 months because they have somebody who's cited at the end of this article who actually lost 123 pounds in a year.
I saw that. Yeah. So the biggest question to me is, do they keep the weight off? Because I haven't seen a single. Um, this is I'm just looking at our patient base.
Mm-hmm.
You know, we see somewhere around 20,000 visits annually. We have a database of probably 10,000 or more patients between our offices and our doctors. Um, I haven't seen. I don't think I've seen any bariatric surgery patient keep the weight off.
Yeah. I think we had a team member years ago who had it, and I think she kept it off.
Okay.
But she's also in a family who's very athletic in nature
Right.
and a little bit different lifestyle.
And then we also had the mom of a child who was a patient of ours who lost quite a bit of weight.
Mm-hmm.
For the most part, she kept it off, but she kept it off because she got into the fitness industry. She actually became like a personal trainer and
Right.
started working, and so she had incentive
Yes.
to exercise and eat right and so on. So that's probably one of the reasons. So I'll take that back. People do keep it off. It says when it comes to whether a patient should choose between Lilly's new drug and Wegovy, the key factors to consider are insurance coverage and the patient's individual response to each treatment.
Okay, for the record, people, your insurance coverage should never be the determining factor for you or your provider. So if somebody is saying that to you, that's not the provider for you. If they're looking at what your insurance says is okay, and we have another article down the road, which is going to talk about that. This is like one of my biggest pet peeves.
Yeah.
We talk about like
I
table
can't-
hitting stuff.
So you're telling me that this is a doctor, right, who says, "Hey, we have these options for treatment for you.
Mhm.
Let me see which one your insurance approves." Absolutely ridiculous. Are you telling me the insurance company, without examining you,
Mhm.
without looking at you,
Yes.
without talking to you, without looking at your blood work, without any of that, knows what's best for you, and the doctor doesn't? And so they tell the doctor, by the way, the doctors are obligated, contractually obligated, to
I know.
only recommend what's covered by the insurance. That's malpractice in my book.
It would be in mine too.
These doctors, well, I don't want them to be sued, but maybe the insurance company should be sued for approving an odd. You remember the movie John Q?
Yes.
What a great movie.
That was a great movie.
I mean, what a powerful scene when Denzel Washington goes, "I'm not burying my son. My son will bury me."
You're getting teary-eyed. That's a big one.
Do you know that movie led to Obamacare being approved?
Really?
It was right before that time frame.
Interesting.
Where, anyways, we don't want to get into politics, but Obamacare, we'll just leave it at that. I totally lost track of time and where I was.
So we're talking about insurance coverage and the patient's
That's right.
individual response.
So now let's talk about risks. Zepbound carries a risk of gastrointestinal issues, including nausea, diarrhea, vomiting, constipation, stomach pain. That's according to the FDA. Now, that means there's more. When they say it's according to FDA, that means there's other ones.
But don't worry. They say that these side effects will not affect a person's quality of life. Now, I don't know if any of you out there have ever had diarrhea. I can tell you
It affects your quality of
it
life.
affects your quality of life. So does constant nausea. I was nauseous for the first 4 months of each of my pregnancies. I can tell you that affected the quality of my life 100%. So did the vomiting. So I will fully disagree with that. I think what we're doing is minimizing, effects
Yeah.
so that we can push this, pharmaceutical agenda.
Well, and that's the patient's fault. Because they want to lose weight so bad, they're willing to put up with this other stuff.
No. They want to lose weight so badly without doing the work.
Correct.
It's different.
Now, the question you have to ask is, why does this cause nausea? Like, what other system in the body
Is it affecting?
is it affecting that cause? Is it because there's toxicity and the body wants to get rid of something? That's why they're diarrhea and vomiting. And then the label, it says the label doesn't specifically mention the risk of stomach paralysis, also called gastroparesis, which we reported on a previous podcast that Ozempic and Wegovy cause as well.
Correct.
It's a more serious complication that some patients have reported as weight loss drugs have skyrocketed in popularity. I mean, because what these drugs do is they slow food passing through your stomach. The problem with that is food needs to get digested quickly because when it sits in your stomach for a long time, it ferments, and now it's not nutritious anymore. That's a personal opinion. So, anyways, it's not fact. Maybe it's fact, but it's not been researched because no one's done that kind of research. But I believe when food goes in your stomach, you want it to digest fast, get into your bloodstream fast, so it brings nutrition. And I know, like when you cut an apple, leave it in the open, it turns brown.
Yep.
Bananas turn brown. Same thing. Food ferments and spoils. So, anyways, in August, Lilly and Novo Nordisk were sued over claims that their blockbuster drugs Mounjaro and Ozempic cause stomach paralysis. And then this doctor said, actually, it's not. This is not a doctor. I've had to stop the medications. I'm sorry, it is a doctor. I've had to stop the medications only on very rare occasions. But the reality is the majority of patients will be able to find a dose that is not causing significant side effects. And end of the article, it's about a person who you mentioned had lost
123 pounds in a year.
She has experienced common side effects including nausea, constipation, migraines, stomach pain, and body aches, but the benefits, she said, have made the discomfort worthwhile. She said, I am down 123 pounds in a year. I mean, I couldn't have done it without Mounjaro.
Well, that's a hard thing to say. I struggle a little bit when people say I can't do that, right? Because we just had a talk with our staff about the word can't. That means you either don't know how or you don't want to.
If you've watched the TV show Survivor, everybody on that show loses weight, which kind of proves to me that if you just don't eat, you'll lose weight. Now, it's not healthy to stop eating completely or live off of bugs and fish that you catch in nature. Anyways, should we move on?
We can definitely move on.
We got another drug one. Cervical cancer. This is from Fox News. Cervical cancer drug raises survival rate by 30% compared to chemotherapy. It's a game changer. The drug is called Tivdak, Tivdak, all capital letters. So better care for cancer patients may be on the horizon. And new prescription medicine for treating cervical cancer has been showing positive results in clinical trials. In phase 3 global trials, Tivdak was linked to a 30% overall reduction in the risk of death compared to chemotherapy. That's a big number. 30%.
Yeah, it is.
Tivdak also demonstrated a 33% decrease in the risk of worsening disease or death. In addition, the intravenous drug showed an improved objective response rate of 17.8% compared to chemotherapy at 5.2%. So like that 17.8 is a lot higher than 5.2. But do you know what objective response rate is?
No.
Okay, it's the percent of tumors that actually shrink after treatment or because of treatment.
Oh, interesting.
That's called objective response rate, and it doesn't talk about it in here. But so you're telling me that with chemotherapy, only 5% of tumors actually shrink?
It's pretty unbelievable.
So if we flip that around, are you telling me with chemotherapy, 95% of tumors with regard to cervical cancer do not shrink?
It's crazy.
95% don't shrink?
But yet we put everybody through that.
And then with this drug in combination with chemotherapy, 17.8%, which is huge. It's like, 1 out of 6.
Yeah. Yeah, that's huge. It also said that Tivdak displayed a 75.9% disease control rate, while chemo showed a 58.2 control rate.
And control is, I guess, keeping it from getting worse.
Correct.
Control rate is the percentage of patients who experience complete response, partial response, or stable disease. So they either get better,
Stay the same.
completely recover, or stay the same.
Yep.
The new class of drugs attacks a certain protein on the cell, which allows chemotherapy to be delivered to the cell in a precise fashion. So basically, just makes chemotherapy more powerful.
Yeah.
It doesn't give a lot of the peripheral side effects that we see with traditional chemotherapy. Now, cervical cancer can be a very aggressive disease, difficult to diagnose early, with a poor prognosis when it is metastatic. It is generally treated with multiple drugs, including chemo and radiation, which can shrink the tumor but very often does not cure it. The new targeted therapy, Tivdak, which includes a monoclonal antibody against the tissue factor associated with the tumor, is an effective additional and useful therapy with a high response rate.
Mm.
So, it goes to show that the whole immunotherapy thing
Yeah.
for cancer is effective.
Mhm.
Tivdak has shown ocular side effects such as conjunctivitis or pink eye, peripheral neuropathy, weakness, numbness, and pain from nerve damage, and some bleeding. But Dr. Kathleen Moore, Associate Director of Clinical Research at Stevenson Cancer Center in Oklahoma City, said she felt that is manageable. Only 5% of patients have had to discontinue treatment due to side effects. So it's so funny because this time 5%, they say only 5%.
I know.
But the other one is like 5% shrink. 5% tumors shrink. It's the same
It's
number.
how we set it up.
How we set it up. Chemotherapy comparatively shows a much higher risk of side effects, including anemia, nausea, hair loss, and neutropenia, which is like reduced white blood cells, according to the same doctor. Tivdak has been used in practice since phase 2 trials led to accelerated approval by the FDA in the U.S., which was 2021. The drug, however, could not earn full FDA approval until phase 3 was complete. Cervical cancer is the fourth most deadly cancer in female patients, according to this same doctor.
Okay. Go ahead. This next sentence is very frustrating.
Read it.
It says, Moore pointed out that the best way to avoid cervical cancer is to prevent it through annual screenings. Annual screenings are not preventative. We've talked about that before.
Early detection is not prevention.
Correct. That is very different, but in the medical world, we use that term all the time incorrectly. The second thing is vaccinations. So HPV.
I think they're referring to the HPV, human
They are.
papillomavirus.
They 100% are.
And the vaccine is called Gardasil.
Yes, and just to let you guys know, years ago there was a huge.
It's so funny you wrote a bunch of notes about this.
I did.
Also.
There was a lot of controversy surrounding the HPV vaccine because one of the creators of it came out and said, this isn't necessary. This HPV is self-limiting. And so we are vaccinating unnecessarily, which could lead to other issues. So this was the creator of the vaccine who stood up. Obviously, she was blacklisted and, all sorts of things. But I did look up, that is very hard to find, but I did look up on U.S. Pharmacists. They said that most HPV infections and lesions are self-limiting on their own in 1 to 2 years, and treatment is often not required. They also said that the best way to prevent HPV, watch out, is abstinence.
Or wait till you're married.
Correct.
So they give the Gardasil vaccine to kids aged 11 to 12, but as early as 9. Again, if this is a STD, that's a little early. And in fact, some of the controversy was that kids who get it become more sexually active earlier in life because they think they're safe. The vaccine is linked to autoimmune disorders, and something called POTS, which is postural orthostatic tachycardia syndrome. Those are people who get lightheaded and faint a lot, and their heart races,
Right.
and then they have to be on heart medication for the rest of their life. It's also been linked to chronic inflammatory demyelinating polyneuropathy, which is like the sheet around your nerves start to disappear, start to get affected through
That would be
inflammation.
painful.
So yeah, basically a lot of nerve pain. So seems to be a lot of side effects to it. And
Yeah.
there's
So do your
controversy behind
research.
it. Again, legally, we are not telling you not to get the Gardasil vaccine. And
But we are telling you that you need to do some research, because when the creators of the vaccine are saying, I shouldn't have done that, we may want to stand and take note,
right.
right? So, yes, from a
Because she
legal standpoint,
apparently
we can't say
gave
that,
up
but
a lot of money
I'm sure
by
she did.
washing her hands of the whole thing and stepping away.
Yes.
We're talking hundreds of millions, probably,
I'm
of
sure.
dollars. So now,
Okay.
next, let's talk about toothpaste.
Let's do it. Let's talk about toothpaste and peanuts.
It's a little lighter. So this is from NBC News. A new toothpaste could help adults with peanut allergies, a study hints. Scientists have developed a new toothpaste that shows potential to prevent severe allergic reactions in adults with peanut allergies. An early-stage clinical trial tested whether 32 adults with peanut allergies could safely brush their teeth with the toothpaste, which contains trace amounts of peanut protein. The hope is that introducing small amounts of peanut to the body over time will help the immune system get used to the allergen and reduce severe reactions. Adults in the trial used the toothpaste once daily for about 11 months. At the end of the study, none of the participants experienced severe reactions or anaphylaxis. An allergic response often characterized by this is the definition of anaphylaxis. It's an allergic response often characterized by difficulty breathing, swelling in the throat, pale skin, blue lips, fainting, or dizziness. Although the trial focused on the safety of the toothpaste and did not test the effectiveness of the treatment in adults, the findings are an early indication that it could help prevent life-threatening allergic reactions in people with severe peanut allergies. And this doctor said the toothpaste should be easier to administer than injection treatments, which are used for allergies to grass, trees, and weeds. Bottom line is, if people, now we know there's a lot of people allergic to peanuts these days.
Oh, it's huge.
And later on in the article, it tells you the numbers. Let's read it. The study participants were divided into two groups, 24 adults who used the toothpaste and 8 adults who used a placebo paste. Over about 4 months, the researchers gradually increased the dose of peanut protein in the toothpaste until participants were receiving the equivalent of about 1/3 of a peanut kernel. The researchers instructed all participants to brush their teeth with the paste for 2 minutes a day, then spit it out. They said the body develops immunity to the allergen over time, and they don't think it's going to serve as a cure for the allergy. They say, while
But they do microdosing now. Like, that is one of the, we had a friend in our small group from church whose daughter had a very, very severe peanut allergy.
Mhm.
So we had to be really cautious when they would come for dinner.
That's right.
And they started microdosing her to get her allergic response, down quite a bit.
And that's the thing. Once the body decides something is bad for it and develops those antibodies are like immune system memory.
Mm-hmm.
And it's hard drive memory. Like, it's not, doesn't come and go. It doesn't wipe out when you sleep. It's always there. So anytime that allergen shows up, your body attacks it.
Right.
So you just want it not to attack it as much. While 54% of participants who used the toothpaste experienced mild itchiness in the mouth and around the lips. Nobody dropped out of the study due to side effects.
I would really love to know, because they did not say this, but we all know how powerful placebo is. I would love to know how many of the placebo patients or study participants actually had an improvement as well.
Yeah.
Like, I wonder why we don't do more placebo studies and figure out how to get the brain to respond, to have the body do something we want it to do.
Yeah, there was one on antidepressants, and they found that when they painted the placebo pill yellow, they got better results.
See? Isn't that cool?
Yeah. Well, University of Harvard, Harvard Medical School, and Harvard School of Public Health has done the biggest studies on placebo,
Hmm.
and they found that the placebo effect is a real thing.
Oh, yeah.
And in fact, their last one of the studies they did, this is the last one I looked at, said even when they told the patient this is a placebo,
It still works.
it still worked.
That's pretty amazing.
So basically, they go, "This is a sugar pill," but some people who take this respond well because they think it's an actual drug. Here you go, and these people still saw results.
That's pretty cool.
An October study published in the Journal of Allergy and Clinical Immunology found that putting a small amount of liquid peanut extract under the tongue, desensitizing young children to their peanut allergy. By the end of the trial, almost 80% of participating toddlers could tolerate 15 peanuts without allergy symptoms. A late-stage trial in May also showed that a peanut patch helped children ages 1 to 3 tolerate the equivalent of 1 to 4 peanuts by helping them absorb small doses of peanut protein through the skin. While about 1 in 50 children in the U.S. have peanut allergies, it's tremendous.
It's very tremendous.
1 out of 50. This is what's funny, because in the 70s, I don't remember anybody having a peanut allergy.
Well, and that's what they say. Another study from the same year found that U.S. adult peanut allergies have more than tripled over the past 2 decades, though the reasons are unclear.
Yeah. Well, we know the reasons.
Yeah.
We know the reason.
We have ideas.
We're not going to say what they are, but
You can message us.
there is a presidential candidate who spoke on specific peanut allergies. He has 5 kids, he said, and you probably know who he is. He has 5 kids. He said, "Why do 4 of my 5 kids have peanut allergies?" And none of us did before, and he says why. So anyways, you can listen to his interview with Joe Rogan. The next step is to test the pace safety and effectiveness among children. A pediatric trial involving 80 children between ages of 4 and 17 is slated to begin next year. So that's good news. I mean, it seems pretty easy. Instead of injecting someone or putting peanuts under their tongue, you brush your teeth with this toothpaste.
Absolutely. Maybe we could figure out how not to have so many of these allergies too. That might be helpful.
Yeah. Well, I don't think anyone's interested in finding that.
Well,
Part of the problem.
I think some of us are interested in it.
Well, the problem is there's no money in eradicating something like this.
That's true. That's true. Lose quite a bit. All right.
Bottom line, healthcare institutions make money if there's sickness, and they lose money if people are healthy.
Right. And they also made a statement that said, they said that the child's immune system is really malleable when they're young. So they said you should seek treatment early. So let's think about that, though. If a child's immune system is super malleable, that means good or bad. What we put into their body can either improve their immune system, or if you're not cautious or you don't have the right data and you're putting something else in their system that is going to affect hormones. We've looked at that, even certain chemicals, right, that we're in contact with all the time,
Well, I mean,
affect all of this.
a couple of podcasts ago, we talked about how when pregnant women are exposed to certain chemicals, their babies become obese
Yeah.
later in life.
Yeah. So we need to think about that in everything that we do. Like
Anything and everything you put in a child's body affects them for the rest of their life, and children are their immune system is much more impressionable, just like their mind is more impressionable. Right. Whatever you teach a child, they remember for the rest of their life.
Absolutely.
You know their behaviors, attitudes, beliefs.
Yep. And you have to educate them, but you have to educate yourself first. Like, you have to know that a lot of things that are in our food right now should not be going into our children's bodies. They shouldn't be going into our bodies. A lot of the things that we're using, soaps, lotions, and whatnot, I mean, I am not super granola. That's not how I was raised, right? So, but through all of the research that we've done over the years, I just know that there are things that we're just not going to do. And we're going to reduce that toxic load as much as we can
Yeah.
so that we can live the most vibrant life possible. But it takes time, it takes energy, it takes intentionality.
I literally drank soda with every meal
Oh,
from
yeah,
I don't know, from the age of, I don't know, 11
right.
until 22, 23.
Oh, yeah. My mother drank a 2 liter of soda every day until she died. I'm talking every day. She had a 2 liter of soda sitting on her bedside as she's dying from cancer.
If you want something
Not healthy.
eye-opening, go to Google and search what happens to your body after drinking a can of soda. Use the main brand name of soda, the one that's the most popular, has a red can, and also do another one because there's a poster that shows every minute what happens in your body when you
It's
for the
crazy.
next 60 minutes, and do the one for the diet soda as well for the same brand. You'll be shocked.
You know, we homeschooled our kids for several years, and one thing that I had our oldest do is I made him watch Super Size Me when he was, I don't know, he was like 8 or 9,
That was a good movie.
and do a report on it, and it was the cutest thing. I should actually pull it up sometime because it was a video, but it was just such. It was an eye opener for him, and he still talks about watching that. And our kids still have never even eaten McDonald's. Like that is just one thing. They're like, no,
I
I just
know.
don't think that's good for my body.
It's a little sad though because McDonald's was such a big part of my childhood.
Hmm. Oh
I
yeah,
just
I had a
like
lot of
even
birthday
now
parties
when I
there.
hear the word McDonald's, I get a little nostalgic feeling
Yeah,
going, we should go.
yeah.
Go sit down at one of the tables. And I remember the red container that had the fries in it and the little box that had the
I
Big Mac
know.
in it. And I don't know if they have those anymore. I mean, it's
I
probably been
don't know,
20
but the
years.
last time you and I ate McDonald's, we were on a
20
road
years ago?
trip.
How long ago
Yes, it
was
was
it?
in California, and we were both like sick as a dog
Yeah.
afterwards. I was like, yeah, we will not do that again. And I grew up on
Well, because
eating
our
that.
system can't handle.
Uh-uh.
Anyways, we're running out of time. I want to do this one last article. Is that okay?
Yes,
Do we
let's
have
do
time?
it.
Well, let's not spend a lot of time on this because this is just a fun article. Fox News: Chicago doctors use breast implants to perform successful double lung transplant on 30-year-old man. A 34-year-old Missouri man was recently saved by surgeons at Northwestern Medicine in Chicago, who used breast implants to successfully perform a double lung transplant. Davy Bauer, 34 years old, whose nickname is now Double D Davy, use your imagination, started smoking cigarettes when he was 21 years old, and typically smoked a pack of cigarettes a day. Bauer, who enjoys staying active by snowboarding, skateboarding, and golfing, said that he switched to vaping in 2014, hoping for a healthier alternative. Now, we reported on vaping on one of the
Way
podcasts,
worse
and
than
it's not a safe thing. In fact,
it's not safe
a
at
lot of
all.
the vape products have been banned by the U.S. And they're still sold in a lot of stores
Yeah.
because they're imported. I felt a little short of breath, he says, was coughing up a lot of secretions. But other than that, I mean, I felt pretty normal until the weekend. And that was just like I didn't have any energy.
Okay, but when we say I felt pretty normal, let's all just identify that when we are not healthy, our body, that becomes our normal,
Yeah.
right? So he probably never, since he started smoking, really had the energy. And
Yeah.
but slowly it waned, and he never realized how crappy he was actually feeling until this moment, right?
The doctor said that Bauer's lungs were so infected that they started to liquefy. If you looked at his x-ray, there was nothing left. The lungs were completely filled with pus.
That is
I mean,
so
so
gross.
basically, his lungs were weak because of all the smoking, maybe, or whatever. And then he got infected, and then the infection did this to him. It was very clear to me that he needed a double lung transplant, but it was also very clear that he would not survive the transplant. So I'm going to summarize the rest of this instead of reading it to you. Basically, what happened was they said, unless we remove both lungs, the infection's going to stay in his body.
Right.
And we can't wait for we can't take the lungs out and put new lungs in when there's still infection in the body. So they had to figure out how to the lungs out and then have him live without lungs for several days and then get a clean pair of lungs and put them in there.
Hoping they could even find, like, the whole story is actually very miraculous.
It is. So what they did was they used double D size breast implants to fill the chest cavity to hold his heart where it's supposed to be when they took all the lungs out, and then they strapped him to a machine that would breathe for him, that would
Yep.
basically oxygenate his blood for him until they got the lungs, and then they put the lungs in, and it's pretty incredible.
It was amazing that they actually found a transplant within 24 hours, which
Yeah.
is just unbelievable. So,
So Dr. Barrett said that he believes that this new technology will open a lot of doors for patients who have no other options. Davy's case is remarkable because it shows that we can keep patients alive after removing their lungs through new technology, which can be transformative for many critically ill patients. And here's what Bauer himself said. Double D Dave.
Double D Dave.
While we don't have definitive ways of proving my years of vaping caused my medical condition, doctors do know for a fact that vaping causes lung injury. If I could go back in time, I never would have picked up a cigarette or vape pen.
Yeah.
And I hope my story can help encourage others to quit, because I wouldn't wish this difficult journey on anyone. Now listen, it's not just vaping and smoking. It's any chemical you put in your body.
Yeah.
And we talked about drugs today. We talked about weight loss drugs. We talked about cancer drugs. We talked about a toothpaste that helps allergies, peanut allergies. Prevention
Prevention.
is most important, which is a healthy lifestyle,
Yes.
which includes exercise, nutrition, sleep,
Mhm.
chiropractic.
Mm.
I have to say that I'm a chiropractor,
Yeah.
but truly
Good
chiropractic.
clean water.
You know what's really cool, really, really quick, because we're done. One of our patients came in with a little bit of neck pain. She's a 14-year-old basketball player. But what's interesting is that her mother said when she went back on the basketball court, she's moving with so much efficiency and coordination. Her athletic ability has like quadrupled, so much so that the parents of the other students are coming up to her going, "What did you guys do?" Because she's a different basketball player than she was
That's so
last
cool.
time. And it's chiropractic care.
Yeah.
Don't underestimate the power of removing pressure from nerves and getting the body to communicate properly. God bless you. Thank you for hanging in with us. Tune
you
in
next
again for the
time.
next one. Please like, subscribe, share, all of that. And we appreciate you greatly. That's a wrap.
That's a wrap. See ya.